I had talked to this gentleman who was just a typical guy trying to do some outdoor work. I think back to a portion of that conversation where he was just talking about making meals during the day and how hard that was. You know, what I'm thinking in the moment around that is, how do I elevate this patient's story?
Our behavioral strategy at Healthwise is to, one, we want to reach people where they're at, and then we want to move them. We employ a few different methods to do that. One of the main methods is what we call a mental model interview process. Mental model research is all about interviewing end users and not giving them any words, not contaminating the interview in any way, asking them very open-ended questions so you really learn from the words of that person what their experience is like.
So a common question will be, tell me about a day in your life. You're struggling with asthma and you're still holding down a job and raising a family. What's that like for you? What do you do in a day? And how do you take care of your health needs in the middle of your bigger, more important life?
And so this interviewing methodology gives us a chance to elicit real stories and real perspectives from people.
After we've talked to 25, 30 patients in a focused area, we have about 200 or 300 pages of research.
And then we comb through that data and build what are called mental models and task towers that help us to understand how people think, feel, and believe about their health.
So from these themes that emerge out of this mental model research, we'll lay out the mental model across a wall. And it's really long. And it's got all these, what we call mental spaces and towers and boxes. It's really geeky. And we'll label these mental models with different colored tags to kind of show the personas that are emerging out of the model.
Personas really distill this huge body of mental model research into something that we can tack behind our monitors.
So I'll actually sneak into people's offices and I will hang the persona poster on their wall just above their computer. And boy, are they surprised when they come back and there is anxious Andy or complacent Casey staring back at them.
He did that because, you know, the evidence around use of personas and user-centered design is pretty clear. If we have a good vision of the patient and we've started with a clear understanding of that and we keep focused on that, the content works better.